Hello, my name is Jacqueline Tamis-Holland, and I'm an interventional cardiologist at the Cleveland Clinic.
Hi, I'm Venu Menon. I'm director of the Cardiac Intensive Care Unit and the Cardiovascular Fellowship Program at the Cleveland Clinic. The other area, in contrast, where I think there's a whole lot of data, is the non-ST elevation MI patient, right? For years, we just took all acute myocardial infarctions and we didn't have much data, but we said the Cath lab was pivotal in their management. We've really learned a lot about the non-ST elevation MI cardiac arrest these past few years.
Absolutely. And in fact, one of our authors is one of the lead investigators for one of those trials, Dr. Carl Kern. And we talk in detail about that. And I think that there's very little data to support having to take everybody emergently to the cath lab simply because they had a cardiac arrest for the purposes of seeing if you have a culprit lesion and opening that culprit lesion. And we talk about those trials in detail. We give examples of the patients that were enrolled in these trials. But I think the other side of it is again, we emphasize the need to think outside the box and not extrapolate every cardiac arrest patient to these clinical trials. If somebody's with ongoing electrical activity or unstable in shock, then they wouldn't have made the criteria for being enrolled in these trials. And these are some patients that may derive a benefit from going to the cath lab, even if they don't have ST segment elevation. So I think it's a really nice overview of these trials.